Hi, welcome back. Here I am with an important special topic in Nclex. It is about the malignant hyperthermia. We're going to see this in detail. What it is all about. So let's go. Is a rare life-threatening reaction to certain anesthetic agents, leading to rapid onset of hypermetabolism in the skeletal muscles. It is a genetic disorder, mainly the autosomal dominant type that usually occurs during a surgery or in a post-op situation. The main common triggers are the inhaled anesthetics, yes, like halothane, sevoflurane, and desflurane. And the other things which are triggering this is the depolarizing muscle relaxants, such as succinylcholine, and certain stress triggers are also present in common, such as trauma, heat, and any vigorous exercise can also cause malignant hyperthermia. The main Nclex step, what we should remember is when we think of any anesthetic agents, plus a succinylcholine is being given to such type of person, then that person is in real danger. Here, the main clinical manifestation, we can see how it has been manifested in system wise is the muscle rigidity, especially we can see the jaw and the neck where there is a stiffness of the jaw, and the first sign is metabolic rapid rise in temperature. Yes, it is a very high rise in temperature that is above 105 degree Fahrenheit. And the late reactions is like tachycardia, acidosis, hyperkalemia, hyperthermia is late, but we should not wait to act. A respiratory tachypnea and increased CO2 and cyanosis, sudden rise in EtCO2, that is, and during the surgery we can see such things. There is sudden increase in EtCO2 in during surgeries. And the cardiovascular changes is tachycardia and any dysarrhythmias, and the vitals will be very much unstable, then this goes highest priority. Here I am going to say with the clinical scenario how we can treat this malignant hypothermia. A 22-year-old patient is undergoing surgery with general anesthesia. Suddenly the patient jaw is rigid and heart rate is 140 and EtCO2 is rising rapidly. The temperature is 38.5 degrees Celsius. What should the nurse do first? So the options here are apply cooling blanket, and B, administer acetaminophen, C, stop the anesthetic agent and notify the provider, D, call the rapid response team. And the right answer here is stop the anesthetic agent and notify the provider. Yes, this is the right answer. The rationale behind this is the first step in malignant hyperthermia to treat is to stop the triggering point. So we have to immediately apply the cooling blankets and the medications as follows, and but immediate removal of the triggering agents saves the lives at the most priority. Here, the patient under anesthesia develops a rigid jaw and rapid rise in temperature and rising EtCO2. The main Nclex action what we should focus is first we should stop the triggering agent, turn off the inhaled anesthetics when we are administering, and stop the succinylcholine if the patient is getting. We have to call for help and we have to activate the rapid response team. And the main thing what we have to do is we should administer injection dandrulan. It is administered IV. It is the only specific antidote which acts for malignant hypothermia. And following by we have to give oxygen 100%, high flow to correct the acidosis. And the cooling measures we have to opt for is we have to apply ice packs, cooling blankets can be applied, and we have to give cold IV fluids. And next thing what we should do is monitor the lab values. We have to do one quick ABG and we have to do the electrolytes check. Especially we have to check for potassium and myoglobulin. So the main nursing consideration is the history. Yes. Ask about any family history of malignant hyperthermia. especially in post-op situation. If they have any previous surgery, we have to ask for such histories, and we have to monitor for reoccurrence within 24 to 48 hours post surgery. And we have to prevent the complications, because mainly the patient may go into kidney injury from the severe condition known as rhabdomyolysis. So here we have to monitor the urine output of the patient and give appropriate IV fluids adequately. And we have to educate the patient and alert the family or the family members to avoid the triggering agents or the triggering things in future surgeries. So this is the important thing. We need to educate the patient, and the main Nclex step here is we have to give the dandrulan, and we have to stop the triggering point, which is the most life saving in such patients. And hyperthermia is a late sign, but we should not wait. We have to cool the patient immediately, start early. If there is any rigidity present in the patient, we can see a suspected tachycardia, we have to act immediately. So this is all about malignant hyperthermia. I hope this topic has given some idea how to go about this condition and act appropriately and save the patient life, which is most important. So thank you and happy learning.